Hi, my name's Kate Crowley. I'm a lecturer within the School of Nursing and Midwifery at CQU. I've been asked to come and talk to you today briefly in regards to workplace professionalism, what it means to me, what I would look for if I was a potential employer, and as a nurse, how we can better relate to our patients, how we can show that we're professionals in the workplace. So first of all, I guess the main thing is presentation. What do people see when you're first walking into a room? And that would be as a potential employer, your colleagues, or even your patients. So I guess promoting that professional appearance is really important. In nursing, we talk about having your hair pulled back. You don't want your face covered, wearing, safe earrings or not dangly earrings that people could, could potentially get in the way. Limited jewellery. And again, in the nursing workplace, you're not really meant to wear a wristwatch, you are meant to wear a fob watch. And again, that's just about safe care. You should be wearing your appropriate uniform. That is, your shirt should be tucked in, you should be wearing correct footwear, and your attitude should reflect that you're there ready to work. You should have your equipment, anything that you've been asked to bring on the day, you should have there with you, and you should arrive at a time, or even early, even 10 minutes before you are due to start your shift, so that you can prepare yourself mentally, you can have a look around the workplace. So that's one of the main things, and I think both your colleagues, your employer or your supervisors, as well as your patients, really respond to that. So that's first of all really important. Moving on to that is the attitude that you turn up to work with when you're in, whether you're doing placement or whether this is once you're actually out on the job. Everybody has lives outside of work, and I think it's well understood about having that work-life balance. However, when you get to work and when you decide to come to work, you need to put all of those things that are happening within your own life aside, and you need to, like I say, be ready to work. And so that includes having your phone in your bag. You don't want to be accessing your iPad or your iPhone during the day. So yeah, those other methods of communication, you really need to save that for your morning tea, your afternoon tea, or your dinner breaks. The other thing is be responsive, have an open attitude. Really, really important is your cues or your non-verbal cues of communication. If I'm standing there when I turn up to work and I appear disinterested, I think most people know what that looks like. So that's arms folded, pouting, this sort of an attitude, not listening, turning away from people when they're talking over the top of people. All of that comes down to respect. Have respect for the people that you're going to work with, so your colleagues, your supervisors, and of course your patients. You need to listen, actively listen, and this is a skill that develops over time. I don't think that we do it very well. We're often thinking about the next thing that we want to say rather than actually just stop. Stop thinking about what you're thinking about and really focus on what that person is saying. They could be really important instructions, from your supervisor in terms of getting a task done or undertaking an assessment, or from the patient perspective, what you're trying to do is engage in a therapeutic relationship. And the way that we start to do that is by stopping and listening and really being in that space with that person or the group that you're in at the time. So I can't stress that enough. And if, it doesn't really matter where that person is from that you're going to engage with. It doesn't matter what language they speak. You really just need to stop and do whatever you can do to try and understand where they're coming from at that point in time. So the other thing I think, which I started to mention before, is being aware of where you're at and the attitude that you bring to work. Emotional intelligence, I suppose, that is being aware of what you can take on any given day. If you've got all of these other stresses going on in your life, maybe you need to be aware that perhaps before you start your shift or before you even come to work, maybe you do need to talk to someone. If you've got all of these struggles that are not going to help you in your day, go and try and clear that, or make arrangements to have a discussion with someone about that later. Particularly in nursing, there's going to be situations and circumstances that we come across that are going to be really difficult to deal with. And that goes from dealing with babies and children right across the lifespan to dealing with death, dying, and care of the elderly. I can certainly speak from my experience that I'm a paediatric nurse, that's my background, but and a lot of people say to me, oh, how do you deal with children? And I have found that a lot easier than dealing with elderly patients, because the end of life stuff is so hard for me. And so as a student, as a professional, I had to become aware of that and where would I be best suited? What did I think I was able to handle? So although we don't always get a choice about where we're going to be placed, particularly in those early days when you're just being placed in all the areas, so you get some experience in everything. It is something to start thinking about, where you might be best suited, what your personality type would, where you would engage best. Another thing particularly pertaining to nursing, though I'm sure it could be reciprocal in other areas, but in particular nursing and activities of daily living. So you're talking about helping people with what could be considered as quite menial tasks, or just those general everyday tasks that patients when they come into hospital aren't actually able to do for themselves anymore. And I can't stress to you how important it is to approach this in the right way. So what I'm talking about here is mobilising, showering, helping or assisting people to the toilet, or even just helping people eat, getting their glasses for them, all those sorts of things that are going to help to engage. So I've often heard students say in the past, the first, second, the third years, and when you come out onto placement as a newly registered nurse, it seems like you're being lumbered with all of the showers, for example. And it just couldn't be further from the truth. It's just when you've got patients that they're vulnerable, they're fragile, safety and care of these people is of utmost importance at that time. And I can tell you that I'm sure they don't want you to have to help them, but in this situation there is no way around it. Perhaps they've fractured their femur, maybe they're suffering from dementia, maybe it's just they're old, and at that point in time they're a bit incapacitated, or at least not able to do as many things as they were previously. So you need to approach that in the right way, having the right attitude. Don't let them overhear conversations about, so that is your patients or your colleagues and other family members, about how you had to help this person take them to the toilet, and how you have to do all the showers and what a terrible job that is. Nobody wants to hear that. So although it's okay to debrief and talk about some of the difficult things that you are facing out in the workplace, make sure you do that at an appropriate time and place. And what you need to do when you're with your patients and when you're out on the floor is have that open attitude, be ready to work, and to be as safe as you can possibly be.